All right, so knock, knock, hand hygiene. Hi, Casey. My name is Sarah. I'll be the nurse taking care of you today. Can you state your name and date of birth for me? We have Casey Banks, 10/2/1965, and Casey Banks, 10/2/1965. Do you have any allergies at all, Casey? And Casey says he's allergic to aspirin. I see that both on the wristband and on the MAR. All right, Casey, so the reason why I'm here today is because the doctor has ordered a medication called furosemide for you. Have you ever taken that before? And Casey says, nope, he has not. So I'll explain that this is a diuretic. I know you're here with heart failure. This is gonna help get some of that extra fluid off of your body. You will pee a lot. That's how the fluid's gonna get eliminated, is through your urine. So we're going to be doing that. It's going to go through your IV. I'll be giving it over a couple of minutes. Do you have any questions before we get started? And Casey says no. So we are going to do our MAR check and check our equipment, and then we'll do our assessments and then get started with the medication administration. So today we have Casey Banks, 10/2/1965, allergy to aspirin. We have an order for furosemide, and I have furosemide IV. This is for IV use, dose of 20 milligrams. This was 40 milligrams per 5 mLs. And based on our calculations, that gives us 2.5 mLs that we drew up. And I'm checking that I have 2.5 mLs in my syringe, which I do. At 0900, it has not been given today. At that time, does not contain aspirin. It was not expired. And we have our calculations here. We're gonna give 0.3 mLs every 15 seconds. Gonna do MAR check 3 for my first flush. So I have Casey Banks, 10/2/1965, allergy to aspirin, order for 0.9% sodium chloride, 0.9% sodium chloride, IV flush, this is for IV flush, BID, 10 mLs, this has 10 mLs in it at 0900. It has not been given today for that due time. It is not expired, does not contain aspirin, and the package integrity will say is intact. Second flush, we have Casey Banks, 10/2/1965, allergy to aspirin. We have an order for 0.9% sodium chloride, 0.9% sodium chloride, IV flush. This is for IV flush. BID, dose of 10 mLs. I'm checking, I have 10 mLs here. At 0900, it has not been given today for that due time. It does not contain aspirin, it's not expired, and package integrity is intact. So MAR check 3 is complete. I've got my calculations close by. And my alcohol wipes, we already checked the package integrity in the bedroom, and I have my gloves here. So I'm gonna do hand hygiene again. And Casey, I'm just gonna take a listen to your lung sounds before we get started. So listening to lung sounds here, okay. And I did assess your output. You have not gone to the bathroom in the last 10 hours. So you're likely retaining all that fluid, which makes sense with your heart failure. So we're gonna keep a close eye on that after we give this medication. I know you have been having good intake, so we're gonna keep watching your INO, your urine output, lung sounds, and then we would want an accurate weight. So we would wanna wait before we give this medication, and then we'll be doing daily weights from here on out, okay, Casey? So we did our pre-assessments. I'm doing my hand hygiene again. I'm gonna get my gloves on. So we've got our gloves here. And before we give the medication, I want to assess my site for infiltration or phlebitis. Casey's got the IV in his right arm, so I'm just feeling around. Does that hurt if I palpate here? Casey says no, it feels pretty good. All right, wonderful. I don't see any redness, swelling, coolness, leaking, anything like that. So that's good. So when I attach my IV flush, I'm gonna pick the port that's farthest away from where it enters the patient. So I'm doing this one all the way over here. It has a green cap on here. If it did not have a green cap, I would be cleaning with an alcohol swab for 10-15 seconds. So I'm gonna take this off without crossing over. And we're going to attach our flush. Okay. I'm going to unclamp, and I'm going to aspirate. So aspiration allows me to assess for blood return. Okay, and I do see blood return. You only need about half an ml or so. So now that I have my blood return, I'm going to check my calculation. I'm giving 1 ml every 6 seconds for this first flush. So I'm pushing 1, Okay, another ml. Pushing another ml. Pushing. Another ml in. Okay, we have just a couple more milliliters to go. Okay, pushing another ml. Another. One more. Okay. There we go. So we've done our first flush. I'm going to remove my syringe. I'm going to alcohol the clave before I connect my furosemide. So cleaning for 10 to 15 seconds. Okay, then we're going to aseptically connect our furosemide syringe, and I changed this to some red so that you guys are able to see better. So based on our calculations, we're pushing 0.3 mLs every 15 seconds. Each one of these lines is 0.1 mLs. Okay. Okay, pushing another 0.3. Okay, we're going to push another 0.3. And we're pushing another 0.3. Okay, pushing another 0.3. Pushing another 0.3. And pushing another 0.3. Okay. All right, I'm pushing another 0.3. And now we're done. So now I'm going to remove the syringe and we're going to alcohol that off again. So wiping this off for 10 to 15 seconds. Okay, we're going to attach our second flush here. So based on our calculations before, and we can see here we have furosemide still on the IV tubing. So I have to give the first 1.5 mLs at the same rate as the medication. So I'm going to give 1.5 mLs over 2 minutes. So we calculate that out. That's 0.2 mLs every 15 seconds. All right, so now I have 8.5 mLs left in my syringe, so we're gonna give another half ml. Okay. So we're going to give 8 mLs over 1 minute. I have 1 ml every 8 seconds. Okay, we have just a couple mLs left, so we're going to leave 0.5 in the syringe so that we don't bottom out the clave. Alright, so now I'm done. I'm going to clamp this, disconnect our syringe. We're going to wipe this off one more time. Alright, and then we'll say that this was a new swab cap, so then I'm going to peel off the label and attach that to my clave. Alright. So I can take my gloves off, dispose of my equipment, and then we're going to document that we gave the furosemide. So I'd write that down here, the time and initial, and put my signature down here. So now that we've done the medication, we are going to talk to Casey again about monitoring urine output. We're going to listen to lung sounds again. We're going to do daily weights. And we're going to be doing strict I&O. So Casey, this medication is probably going to make you urinate a lot, but that's normal. That's how all this extra fluid is going to get off your body. If you have to go to the bathroom, we just ask that you not place any toilet paper in this hat because it can impair the amount that we're reading for how much urine that you need. It might make you feel a little dizzy or lightheaded, so just give us a call if you have to get up out of bed, because it can cause orthostatic hypotension, so just give us a call anytime you have to move. And we will do our documentation in the flow sheets, and I'll be back in about an hour to reassess everything. Okay, Casey? He says okay, so I'm gonna leave the room and do our documentation.